moment. So those of you who are on right now, welcome. Thank you so much for joining us. Please share the video far and wide because we know that fibroids is a thing that it affects a lot of women, especially women of color, especially Black women. So we want to make sure that we share the information so that more people can be helped by the expertise, the experiences, the knowledge, the wisdom that we this panel can lend. So we'll take just a few more moments to share, but again, please share it far and wide. Hey, Dr. Robinson, Dr. T. Rob. All right.
How do we share it on our page?
You will go to the Naturopathic Doctors of Color Facebook page and then just click share.
Okay. Got you. Thank you.
All right.
Oh, here we go. Okay, perfect.
All right. So, where am I? All right. So welcome. Thank you very much for joining us. I greatly appreciate all of you who are here. We are a representation of the Naturopathic Physicians of Color. And again, we are talking about fibroids. Fibroids is a condition where basically you have cells inside of the uterus that just continues to grow and they create masses. So basically big tumors inside the uterus. Usually they're non-cancerous, but they are big tumor, or there are tumors. The thing about them is that from what I just researched, 70 to 80% of women are expected to have them, but not everybody will have symptoms. All right. What creates symptoms is location and size. So a woman can go her entire life and have fibroids and never know it because she never has problems. She never has symptoms. Some women have symptoms, but they don't really cause any problems. And then some women have really bad symptoms, really bad problems, and have to have procedures to help them to deal with the fibroids. And that can be a number of things. It can be anything from natural therapies to hysterectomy and anything in between. So before I go any further, I want to have the experts here on the panel to just share who they are and why they decided to join us on this panel. So I'm going to start with my screen. I have Dr. Olivia Watkins on my screen first. So share who you are.
Hi, everyone. So honored to be here and be a part of this conversation. My name is Dr. Olivia Watkins. I graduated from the Southwest College of Naturopathic Medicine, winter of 2018. I'm currently practicing in Phoenix, treating mostly women's health. So like all things women related is my jam. I love it. I grew up in a family with a lot of women. I went to a women's college in undergrad, joined a sorority, and I just like love to give back to my community in that way. Fibroids is so common, especially amongst African-American women. So it only felt right to me to like jump in on this conversation. And I'm just really excited to share clinical pearls and see what everyone else's experience has been clinically and just community-wise. What has that been like for us as African-American women, women of color?
Thank you. Next is Dr. Dezi.
Hi, I'm Dezi Nebedum. I am a student at Southwest College of Naturopathic Medicine. I am here primarily to share my experience in dealing with fibroids. I recently had a fibroid artery embolization surgery just 4 weeks ago, and just sharing a little bit about that process and some of the concerns that arose from it, but also the wonderful benefits that happened.
Okay, thank you. Also, if you can get a little bit closer, you're a little bit hard to hear. Just, or speak louder. whichever one. Dr. Krystal.
Hello, everyone. I'm Dr. Krystal Shelmire. My business is Alternative Natural Health Solutions, and I'm located here in Louisiana. I personally struggle with fibroids, and I'm just so tired of seeing women that are in their 30s that think it's normal to not have a uterus. So I want to be a part of the change.
Thank
that's
you.
me today.
Thank you. Dr. Sharm.
I'm Dr. Charm Timms. I am a naturopathic physician with a specialty in family medicine and pediatrics. And I've had my own experience with personal experience with fibroids, and it's definitely informed my outlook on women's health. And I'm very excited to be speaking about this today. I'm here in Chicago, Illinois, and I'm just excited about this subject.
Thank you so much for joining us. And Dr. Imani.
Oops, let me unmute. Hi, good afternoon or evening, depending on where you are. I am Dr. Imani Owens-Bailey. I am located in Tacoma, Washington. I'm so glad to be here and be a part of this panel. This topic is one that is near and dear to my own heart, not only from my perspective as a naturopathic doctor and an acupuncturist, but also from my personal perspective. I have personally been one who has dealt with fibroids for a long time, and women in my family have dealt with fibroids, and then women in my community circles have dealt with fibroids, right? And so there are a large number of women who are dealing with fibroids, not knowing where to turn, not knowing what to do about them, getting conflicting information or told that hysterectomy is the only way, right? And I believe that we have so much to offer in terms of information about what else can be done, and also things that need to happen when it does look like they need to be removed or come out. So glad to be a part of this. Glad that all of my colleagues, we're all on here and ready to share with everybody. So thank y'all.
You, Dr. Imani. I appreciate that. And I'm Dr. Turshá Hamilton. I am currently located in New Orleans, Louisiana. My focus is diabetes, hypertension, and digestive disorders, but I do work with the whole person. So of course, having people who happen to have uteruses walking through my doors or connecting with me means that I will often work with people who have fibroids, some experience with fibroids. And so, you know, I wanted to have everyone come on and share some of the things that we can do, some of the things that we hear, some of the things that are incorrect, some of the things that are correct, and answer your questions. So with that being said, if you all have questions at any point during our discussion, please feel free to post that in the comments. I'm actively looking at the comments so that I can see when you have questions and we can answer those for you. So first I want to talk about, I've already mentioned what fibroids are. Did anybody have anything to add to that when what I was saying about what fibroids are? Okay, just wanted to make sure I didn't miss something. So symptoms of fibroids, as I mentioned before, fibroids, a person can have fibroids and not have any symptoms at all. But some symptoms that you will, some symptoms that you can look out for are bleeding during your PMS, bleeding during PMS, really heavy bleeding during PMS, because again, it can be a spectrum, painful menstrual cycles, and it can be as bad as infertility, miscarriages. What are some other symptoms that can occur? Because I feel like I'm missing some.
Well, depending on the size of the fibroids, and sometimes once they've gotten to be a significant size, there can be a sensation of pressure in the pelvis. And depending on how fast they are growing, how many there are, they can even grow up into the abdomen and cause pressure on other internal organs. So there could be some pressure in the abdomen area and pain there, and not just during periods, but during other times as well. And sometimes if they're of significant size, they can put pressure on the bladder. So you can end up having to feel like you have to pee just all the time, right? Because they kind of compress the bladder. So there's less space there. And so you have to urinate more frequently, especially during the night, many times during the day. And there can be a constant sensation of kind of discomfort as well.
Any others? Dr. Olivia?
I've definitely seen symptoms of constipation, which was really wild to me. Urinary symptoms, like Dr. Imani said, changes in the urinary symptoms, pain during sex, feelings of fullness in the abdomen, low appetite. Patients aren't able to eat as much as they typically would because it's starting to take up space in the abdominal cavity. But yeah, the constipation is one symptom that was very, very odd to me. And it was one of the only symptoms that one of my patients had when we were working her up for fibroids. She didn't have any of the other things.
Wow. So a lot of times, I'm sorry, before I say that, well, did anyone else have any other symptoms that we missed?
I've noticed since my surgery, since my procedure, that I have better circulation in my legs and it's easier to walk.
Okay, thank you. Thank you. A lot of so someone in the chat mentioned bloating. Absolutely. One lady said she had the appearance of a 4-month pregnancy. So the thing is that your uterus sits really low in your abdominal cavity. So when we say your abdominal cavity, we basically mean the area underneath your rib cage and basically right at your where your hips begin. So it sits basically beneath where your hips are, okay, in your really low abdomen. But as they mentioned, if you have these growths that grow too big, they start to move into other spaces. So if you're having constipation, then it's big enough to actually press against your colon. If you're having urinary symptoms, it's big enough to press against your bladder. And as Dr. Imani mentioned, if it's big enough or they're taking up enough space, it can push all of your other organs up so that now you have trouble breathing. Your liver might not function well. Your stomach might not function well. Your all the other organs that are in the top of your body may not function well. So how do you work this up? How do you know if a woman has fibroids? How do you even make that determination? Dr. Dezi? It looks like you're about to say something.
Well, I can say that for myself, I was having very heavy menstrual cycles. And so they did a vaginal ultrasound with a long vaginal wand, and they took imaging. And that was probably about at least 15 years ago. And since then, that initial diagnosis was that I had 4 fibroids, or at least that's what I was told. And most recently, before my procedure, the number was probably over 20, Wow. My uterus was 4 inches longer than normal. And it also the weight of the uterus was greater. And normal uterus is about 100 and something grams. Mine's is over 800 grams. And so all of that weight is pushing down into my pelvis, is pushing on my bladder, as other doctors have said here. And as a result, I had to take muscle relaxants for the last 3 years plus in order to, so I wasn't having to go to the bathroom all the time.
Okay.
What you'll see is, pretty much the diagnosis is going to be via ultrasound, what we call abdominal transvaginal ultrasound. And also, if a lot of women are going to have this heavy bleeding, and so in a blood count, they may show up as anemic, low iron, which is what anemia is, low iron count. And so that will usually kind of be a red flag. with that prolonged bleeding, that they're getting anemic, and we're trying to figure out why. But really, you're going to see it on some type of imaging, to where you can see that they are there.
Dr. Imani?
Yeah, so just agreeing with what both Dr. Dezi and Dr. Charm just said. So it's a diagnosis that includes the information that's gathered during the history taking, like the history of having really painful periods, really heavy periods, that urinary frequency, pressure in the abdomen. So all of those different symptoms. But then the next step is to get the imaging. And as Dr. Dezi mentioned, the transvaginal ultrasound is one of the first places, one of the first stops for the imaging. Additional imaging may include ultrasound, other ultrasounds of the abdomen. And if it gets to a certain point where they want to see where the blood supply for individual fibroids are coming from, they might do an ultrasound with contrast. And so that's where they inject a contrast media that is going to follow the flow of blood, and it allows you to see where exactly these fibroids are getting their blood supply from. And that becomes a factor later on when you're looking at getting ready to remove fibroids. Then you want to know where the blood supply is coming from. But definitely the ultrasound imaging coupled with the history, and that helps you to make that diagnosis of fibroids.
Dr. Olivia?
I'd like to add that depending on the size, you can also pick them up when you're doing pelvic physical exams.
Yeah.
So that's usually for women who have heavy periods. If you do that pelvic exam, sometimes you feel them if they're big enough. But the ultrasound, like everyone has said, is usually like the definitive diagnostic tool that you would use to confirm.
And just to piggyback on what Doctor was saying about the pelvic exam, this is why it's important for women to get their annual gynecological physical, their annual women's exam, because part of that, what's involved in the women's exam is they're going to do a pap smear for women that are sexually active, and they're going to do the breast exam, and then the other part is that they do a pelvic exam where the fingers are inserted and they're checking in the vaginal area, and then they're going to press a hand over on the uterus area to feel for any type of lumps or abnormalities, and just feel if the size of the uterus is enlarged. So this is where it comes in to make sure that the women, that you're getting these annual women's exams.
Absolutely. Dr. Krystal, did you have anything to add?
I think they said it all.
I agree. I would say when I was a student and I felt a fibroid just from pressing on the top of somebody's, abdomen, it was, for me, the coolest thing. Not for the patient, because that meant that it was big enough to feel, but it was really, it was kind of wild that like you can actually feel these growths if they're big enough just pressing on the abdomen. So I know that there is a movement in medicine to have people get less checks, less checkups, less exams, less testing for certain things. But you know what? These tests are so important, especially things like this one, so important because it can definitely affect your quality of life. When a person comes into your office and they have gotten a diagnosis of fibroids, either from you or from another clinician, I know that one of the first things that people ask, not just about this, but everything, they usually say, what herb can I take for this? I already know, some people who are watching like, what herb can I take and what can I eat to get rid of it? So I want you all to address that in your way, your naturopathic way, however, whatever spiel you use when people come and talk to you. Dr. Krystal, because we hadn't heard much from you, I want you to tell us, what's the first thing that you say when someone says, Dr. Shelmire, what herb can I take and what can I eat to get rid of fibroids?
I tell them that it's not that simple to begin with. It didn't happen overnight, so it's not going to be healed overnight with just one herb. It's really multifactorial. So I really explain to them the whole naturopathic way of doing things. It's about your mental, emotional health, which is just as important as your spiritual health, which is just as important as your physical health. So an herb that may just address the physical component, but you really have to address everything in order to really heal with any illness.
Yes. Dr. Charm.
The thing that's the fibroid is probably the end stage. People look at the fibroid as the problem, but the fibroid is the physical manifestation of of a hormone imbalance that has started long before then. And so, women have heard about the hormone estrogen. Obviously, women have more estrogen than men have some estrogen. Women have more, but we have two forms of estrogen. We've got a good estrogen and a so-called bad estrogen, and it's many women are carrying around they have high levels of estrogen just because of the environment, or a lot of the eating things in plastic or heating foods in plastic, the toxicity and chemicals and so forth, the cosmetics and all these things. This affects your estrogen levels. And so when we're in a state what is called estrogen dominance, where you've got the bad estrogen that's dominating, it wants to grow things. So you get ovarian cysts, and you get the lumpy breast or the fibrocystic breast, and then you get the fibroids and the endometriosis. So all of these female problems that we're getting where you're growing things is because this estrogen is just really out of control. And of course, the fibroid themselves are a problem, but you've got to really get to the root cause, which is this hormonal imbalance.
Thank you. Dr. Olivia.
Yeah, so again, to piggyback off what everyone says, you have to really think about it from this multifactorial approach. Fibroids just don't pop up. They don't just happen. So like Dr. Charm said, it's an estrogen-driven condition. So we have to figure out, how are we getting estrogens in our environment, whether that's through our water, our cosmetics, our beauty products, our detergents, cleaning products, our foods. Also, how do we metabolize estrogen? So how can we support the body's process of getting things out? I love talking about poop, so I'm just going to go there. Constipation. We get a lot of our excess hormones through our stool. So if you don't have like your regular cleanup things happening, that's where I like to address first. Like, let's play cleanup first, and then we can start to dive into herbs and then other treatments like acupuncture or microcurrent. So just having that conversation so that they understand how we have all of these factors that play a role, I think that's really important in patient care. If I had to say one herb, though, I would say Vitex, chase tree berry, primarily because of its role in LH and progesterone. We have that estrogen progesterone imbalance with these estrogen-driven conditions. So a lot of the times, these women are not producing enough progesterone to calm that down. I think of estrogen as like the fertilizer, and our uterus and our uterine lining is like grass. So if you just have all of this fertilizer, you're just going to continue to grow. You don't have progesterone that comes in and says, you can chill out now. You don't have to keep proliferating. So Vitex would be my herb of choice if I had to choose just one.
But that does not mean that that's the only herb to use,
No.
and that it's a magic bullet. So I just wanted to let folks know, you can go get Vitex. It can help, but that doesn't mean that you take it and it's going to go away immediately. And if it doesn't go away, then you're mad at Dr. Olivia. That's not what she said. Dr. Dezi, do you have a spiel that you tell people?
No. Again, I'm still a student, and I'm learning, but my experience has been from my experience for the last 16 plus years dealing with this issue, again, with the hormones. Before I started with the procedure, I was on different hormone therapies, and I think a lot of them exacerbated the problem. I wish, I was consulting with different other doctors, and I wish more of it had been a discussion of the botanical medicines, the herbal medicines that could have helped me. But we did some homeopathy and had both good success and other success with homeopathy for me. I'm very sensitive to it. But then we switched to the hormone therapy. And I think adding all those additional hormones onto everything really was unfavorable to my system. I was barely able to remember things. I couldn't function some days. I was exhausted. I was swollen up, not as badly as before. It was still good. But what really helped is when I took the DIM, and it got rid of that excess estrogen, and things started clearing up mentally. And then I was able to proceed with what needed to be done and find some help with that. So.
All right, thank you. And Dr. Imani, what's sort of your spiel?
So I guess I don't really have a spiel, so to speak, but acknowledging that estrogen dominance plays such a large role in the development of fibroids, then I like to look at the step kind of before you get to estrogen dominance, and that is what's creating the imbalance in the system that has led to the estrogen dominance. So let's look at lifestyle. As my colleagues have already mentioned, let's look at diet. The different things that you're eating and whether or not we're contributing to a pro-inflammatory state, a state where the body is out of balance. Let's look at the things that you're exposed to, sort of external estrogens that we can get through the heating of plastics, as one of my colleagues mentioned, the different cosmetic products that you use. And for us as Black women, especially the hair products, that's one of the hidden sources of a lot of exposure to things we really don't need in our lives, are all of these different things that are packed into hair products that aren't natural, because our skin, our largest organ of excretion, but also our largest organ of exposure, takes in so much. And then two areas that I feel like aren't talked about enough: the role that stress plays in creating imbalance in our bodies, and just stress from life, stress from racism in society, stress from finance, all the different things that can be stressors in our lives, and how our bodies are able to deal with or really not deal with so well that stress. And then the second thing is movement. I am also an acupuncturist, and from the acupuncture is rooted in an East Asian medical system. And looking at that, they look at fibroids as stagnation. All right, stagnation, especially in our pelvis and our pelvic cavity. How many of us have lifestyles where we are sitting a lot of the time? There's not enough movement. And for those of you that know me, I'm also kind of known as the dancing doctor. And so I advocate movement of the hips, especially. Increasing circulation to our pelvic area is really so important. Getting up, walking outside in nature, all those things that we can do to increase circulation and move our body. So, in short, what I talk about is, it touches on so many different areas in life, and it's kind of specific to who's sitting in front of me, because everybody has a different story and a different source for their stress, a different factor in terms of exposure. But yeah, those are some of the biggies that I like to discuss with folks.
So the moral of the story is that there is not necessarily one thing that causes it, and there's not one herb or one food that can fix it. But there are herbs, there are movements, there are foods, there are things that you can do that can help your body create an environment that is less favorable for the fibroids, so that your body can then remove them, all right, or at least begin the process of doing what it needs to do to remove them. So I know that at least one person who's watching is an esthetician and uses makeup all the time. And several of you have said that makeups and hair products can cause this estrogen dominance, this estrogen imbalance. Can you guys talk more about what that looks like, especially for people who wear makeup all the time? Is it a particular type of makeup? Is it, blush? Is it lipstick? Is it eyeliner? Like, what is it? And why? Why is it a thing? Anybody can jump in.
Well, I don't know much. That's not my forte, but I do know, like, with they definitely use urine, like urine in some of the products. The lipsticks have hormones in them. A lot of them have animal based, and so you have it's just a treasure trove of stuff that's in a lot of these cosmetics. And some of it, I mean, unless you're going completely organic, which this is why we have such a plethora of some of these organic companies that are popping up that are doing cosmetics. So that's one solution. The other thing too is your body's going to be exposed to so many different things. I mean, just walking outside, you're hit by what is the air pollution registry for the day? What's going on? You're getting hit with frequencies from cell phones and towers and things. But really, what is going to be different between each individual is how do we handle that? What is your detoxification like in your body? How is your body processing this? Some people's bodies are better at detoxifying the arrows that we're getting, these arrows of outrageous fortune, as Shakespeare said, that we're just getting hit by. And so really, I would be a proponent of making sure that we're detoxifying and are able to eliminate and clear these things that we're constantly getting bombarded with. And that's definitely going to be individualized on each patient, making sure that we have really good liver and kidney health, because the liver is your main organ of detoxification. And a lot of people are drinking, and with meat eating, that's a huge way we're getting hormones in, just because the animals have hormones in them, not even if they're injected with them, but you're just getting them that way, and they're filled with antibiotics. And so kind of going towards more organic meats, organic vegetables, you're getting with pesticides hit with hormones, because these pesticides are what are called hormone disruptors. So the way they kill the insects is that they interfere with how they interfere with their hormone system. So if we're able to kind of at least reduce the outside things that are coming in, and then internally really eliminate and improve that system and optimize that system, we will have a lot of better results.
And I want, oh, sorry, Dr. Imani, go ahead.
Oh, go ahead.
Dezi, go ahead.
Back on what Dr. Imani and Dr. Sharm said, was that's exactly what I had to do. I have adrenal fatigue, I had immune issues, I had so many toxins coming in, I could not filter them at all. And so I had to look at, I had multiple doctors working on me. This was a group project, a village project to get me, back on track. I had an AK who pointed out, like, I'm using toxic, deodorants, and I need to change what kind of deodorants I have. I went through with nutrition specialists and found out what I was allergic to, what was inflaming my stomach and irritating my colon. All those issues have disappeared as well. And, like when I ate certain chickens, I noticed that I could taste like hormones in them. I had to switch where I was sourcing my food. I buy a lot of whole food from the markets, from farmers markets, and try to grow some myself. I have a little aero garden machine on my counter. It grows me, herbs and veggies. It's wonderful. I recommend them to everybody. But I had to just do something so that I was not constantly putting in toxins. I use olive oil on my skin instead of lotion most days. I try not to use an air conditioner. I just use fans most days. So it's just making those changes. And if you make enough of them, you can clear out all those issues, hopefully.
Okay, Imani.
So in terms of, especially for, you were saying that there was someone who was an esthetician. So, and just, if you like wearing makeup, you're applying cosmetics, or you're using other products on your skin, I always say, be aware of ingredients. Look at the ingredients, look at what you're putting onto your body, look at what you're putting into your body. And if you want a good place to start with some information on consumer guides for cosmetics, cosmetic lines and ingredients, the Environmental Working Group has a consumer guide on cosmetic products. You can find information on, like, your favorite cosmetic lines and different ingredients that are commonly found in different cosmetics on that site, and they give you information about what may be harmful chemicals that are in something versus things that are less benign. And so you can really do comparison and make informed decisions about things that you're using on your body. And I always want people to be informed and really in the know. So it's not just about how it looks, but it's about its effect on your body as well.
Absolutely. One of what is it called? Is it called Skin Tight or
Skin Deep.
Skin Deep.
Skin Deep, and also Think Dirty is another app that's really good for that.
Okay. Okay. So the environmental working group, I typed in the website for the environmental working group. It's ewg.org. And on that, you'll look for Skin Deep. And that is the website that will talk to you about like the ingredients, the makeup lines and the different ingredients, and they'll sort of rank them from most toxic to least toxic, and that'll give you some information. So if you like to use makeup often, whether it's for yourself or for someone else, then that is a resource that you can use to learn more about the makeup. What was the other one that you used, the app, Dr. Shelmire?
So Think Dirty is another app I tell a lot of my patients about. It is awesome because you literally go to the store, you pick up a common product. I mean, one that they commonly make fun of is Johnson's baby lotion. But you scan the barcode and it literally tells you every ingredient in there and how it can affect your body. For example, fragrance is one. Everybody loves a perfume. If something smells good, it probably has fragrance in there, which is going to be an endocrine disruptor, which means it's going to mess up your hormones. So once people can see that for themselves, they'll make better choices.
Absolutely. Now, we talked about how the skin is, of course, it's like the largest organ because it's the one that covers our entire bodies. And what goes on our skin goes into our bodies, right? But again, as many of you have mentioned, not everyone is going to be affected by everything. The biggest factor is how your body is processing and eliminating these things. Can you talk about or tell us some key things that we need to know about processing and eliminating? And of course, after this, we'll talk about pooping. Or, you know, in this conversation, we'll talk about pooping. So those of you who don't know, myself and most of my colleagues love talking about poop because it's such an important part. Never really listen to the doctor talk. And this is the first of you'll hear about. Back to you later. What do you consider that you test for? Give us some information about that whole detoxification piece, because I know there are some people who say, well, the body detoxes on its own, and if you don't detox, you're going to die. So this detoxification stuff doesn't really matter because your body's going to do it. It's hogwash. What do you guys usually do and say?
I usually, well, by the time people find me, they've really gone through the ringer. So one thing that I think we haven't mentioned just yet, especially if you see someone with a strong family history, like all of their aunts, their mother, their grandmother, everybody with fibroids, I would really suggest looking at genetics. I know 23andMe, if you're not afraid that they'll take your information, they have the ancestry report. That's wonderful to figure out where you're from, but they also include genetic, they include a methylation profile and a detox profile as well. And if you bring that to someone like a naturopathic physician that knows about genetics, that can help you make some sense of those things, you can actually see what types of products, especially supplements, medications, and things that you put into your body, how your body detoxifies those things. So you can really individualize your treatment plan on a whole new level. So people should know that that option is there as well.
So on that, do know that those types of profiles are available. Anybody can get them, but the interpretation of them can be a little bit or a lot tricky and detailed. So you want to make sure that you go to a practitioner who actually knows how to read the information and decipher what it means and how to use it in your medical care. So again, anybody can get these tests, but they're not necessarily the easiest to read and make connections on what to do with that information. Who else? Detoxification. Yes, Dr. Olivia.
I think it's important that we address weight.
Okay.
Because estrogens can be stored in fat. So
Yes.
we see a lot of obesity in our communities. And then that obesity is just fed through the things that we eat. So then we're getting more estrogens from unclean meat or dairy products or processed foods or what have you. So movement, again, movement is so important, whether that's energetic movement through acupuncture or microcurrent or actual manual movement. So exercise, making sure that that circulation and that lymph flow is intact. I also like pelvic lymphatic massages because it supports that circulation specifically in the pelvic region. So those are two things that are usually cost effective for my patients. It doesn't take a lot for them to add that on board, that I like to have in the conversation.
Yeah, that's important.
It's really interesting, the kind of like as far as the weight gain and the estrogen, it's really an ironic thing, because having extra weight will increase your estrogen, but also having increased estrogen will make you gain weight. And so it still goes back to detoxifying and really being able to clear this stuff, because if you're not clearing the estrogen, you're working out and you're doing all those things that you're supposed to do, especially women who are in the what we call the perimenopausal age, which is you're starting to get, you're over 35 and you're not menopausal yet, but you're starting to get there. Women start to get that little pooch, or the little, they call the fupa. And that's estrogen. That's estrogen settling in. And so it is really important to get in, and we're like, okay, I'm working out, I'm eating, portion control, and I'm doing this and that, and it's very difficult for me to lose weight. Well, that can be one of these signs and symptoms of estrogen dominance and not being able to clear this estrogen.
Thank you. Yeah, one of the things too that I want to make sure that we highlight is that fat actually turns other hormones into estrogen, and estrogen can be stored. So if you're gaining weight, it can actually cause your estrogens to increase. High estrogens can cause your weight to increase. So it's sort of a vicious cycle, which is why you want to make sure that you use this multifactorial approach to help to modify your estrogen balance in your body. So keep that in mind. Other docs?
All right, so I'm going to say it. I'm going to go back to it. Pooping. Okay, so I can't tell you the number of patients that I have had who have said that, they are used to having a bowel movement only maybe every 2 to 3 days instead of on a daily basis. So what happens when you have 2 to 3 days or more worth of waste just in your colon? Our colon not only hold waste, but there's a certain amount of reabsorption that happens in there. And there's supposed to be a natural passage of that waste out of the system. But when it just sits there, things are recirculating over and over and over again. And it is like literally as if you are poisoning your system, right? And so I can't say enough about getting to a state where you're able to have daily or even multiple bowel movements per day. And how do we do that, right? So it's a combination of things. So it's a combination of diet and what we eat. It's a combination of hydration, because when you're chronically dehydrated, right, you tend not to have your bowel frequency that you need, your bowel movement frequency that you need. Also, going back to movement. Movement is our perfect way to help get our colons ready to pass that stool, especially when you're doing movements that involve your pelvic area. So all of those things need to be looked at when you're looking at helping someone to detoxify their body. On the most basic level, you gotta poop. You need to move that stuff on out.
So speaking of pooping, what are some of the things that you all like to have people do to help increase elimination and pooping?
Castor oil packs.
Castor oil packs. Excellent.
Also cost effective. It's
Yes.
simple, and it also makes them relax because you got to sit still to do it.
Yes. So castor oil packs, basically you take a piece of material, usually flannel, you put some castor oil on it. You usually put that over your liver. You can put it over your abdomen. You can put it directly over the fibroids. But like I said, usually it's over your liver, and you sort of let that heat, you can put a heating pad on it or not. And you let that sit over your liver, and that helps to get things moving a little bit more. Others?
Warm teas and abdominal massage. Right?
Warm teas.
So
and
warm
okay.
teas starting off in the morning and in the evening before you go to bed, and also during those times, abdominal massage. Abdominal massage that's going in the direction, you're starting at the lower right quadrant, and with firm pressure moving up to your upper right quadrant, moving over to the left side, your upper left quadrant, and then down to the lower left quadrant, and making a big circle and going around with firm pressure. You can do that early in the morning as you are lying in bed, preparing to have that first bowel movement of the day. Then you can get yourself a nice cup of warm tea, have it there, and just do some self-care, self-love time, massaging the abdomen, drinking some tea. If you chase that tea then with a cup of cold water, and then get yourself ready to go to the bathroom, that oftentimes induces a bowel movement to move. In the evenings, you want to kind of finish your day as you're laying in the bed after you've had your evening tea. Again, laying in the bed and doing some abdominal massage. This is something that you can do for yourself. If you have a partner or a significant other, you can get some help, get them in on the act. You're trying to stimulate movement, and that movement there is stimulating your colon and your whole system to relax and release.
Is there a particular type of abdominal massage that you recommend, or just basic abdominal massage following the colon?
So abdominal massage, as I learned it and then practice it and teach it to my patients, is coming from the Tui Na system, which is, again, that system that's correlated with acupuncture from the East Asian medicine. And it's just using a firm hand pressure to massage the abdomen in that same direction that I mentioned to you. So you start off making large circles with firm pressure, and then gradually get smaller and smaller until you get close into the navel, and then you can make those circles larger again. And you're doing that while you're relaxed. You can have your feet planted on the bed so that your knees are up and your stomach is in a relaxed position. And this should be a relaxing type of massage, but firm. For those that have the pressure already in the abdominal area from fibroids alongside, I don't want you massaging hard enough to that it's painful, right? But it's a firm pressure, but it shouldn't ever be painful as they're doing it.
So you can actually do like a Google search and find videos or charts to help you with the direction, so that you can know how your colon flows, how your waste flows out of your body. That's the direction that she was telling you, is you start at one end and then you help to push it out of your body. So so there's that. What else? What are some of the things that you all recommend to help your patients poop?
Magnesium.
All right. Any particular kind?
So we're not supposed to mention actual supplements here, huh? Like brands. Can we just throw it out there?
Do what you do. Do what you do.
Okay. I really like Vital Nutrients Triple Mag because it has 3 different types of magnesium. It has glycinate, it has oxide, and it has magnesium citrate, I believe. Magnesium oxide can be irritating to the gut, but I found that when you have it with other forms of magnesium, it's a little more gentler. So you get that osmotic pull of like drawing water into the stool, which helps that peristalsis to move things out. So I really like that product because it has a combination.
Okay, thank you.
You're welcome.
Other recommendations?
Are we still talking about pooping, or are we?
No, we're still. I still wanted to make sure.
Okay.
We still, yeah.
Okay.
So one of the things that I actually like is fiber. So, you know, ways to increase fiber. Of course, you can eat more vegetables and high fiber fruit, but there's also psyllium. Basically, psyllium is a bulking laxative. And so what it does is you drink a lot of water with the psyllium, it sort of gels up and bulks up, and it acts as a broom to push things through. You can use chia seeds, but you can especially do flax seeds. If you do flax seeds, you want to get them whole, and it's best to grind them right before you use them, or within a few days. If you're going to grind them and use them within a few days, put them in the refrigerator because you want all the oils and everything to still be fresh. But that is the best way to do it. And so those forms of fiber are definitely going to help. Anybody have anything else before we move on?
I eat a lot of broccoli, 1 to 2 plates a day. So up to a whole plate heaping pile of broccoli every day. And that has really seemed to clean. I can't talk about poop. All right. But
she's still in school, so she's not used to talking about poop as much as we are.
So you should talk about it in public.
But that brings up a good point that broccoli is one of those cruciferous vegetables, and cruciferous vegetables are very good with helping the body to balance estrogens, right? So they've made like extracts from cruciferous vegetable products, but if you want to get it naturally, foods like broccoli, kale, cabbage, cauliflower, those are the cruciferous vegetables. And so do you guys have like a recommendation of how much cruciferous vegetables you want your patients to eat every day? Because that I actually don't know.
I just give them because I think it would be pretty difficult to get a decent size amount from diet and be able to be around other people, because cruciferous vegetables can cause a lot of gas. So I usually supplement and just have them eat what they can as part of a normal healthy diet.
Okay.
Yeah, it goes away. It doesn't. That's only in the beginning.
Dr. Olivia, were you about to say something? Okay, so try to get a couple cups at least of your cruciferous vegetables every day, so that you're at least getting the fiber along with all the nutrients and everything else that it has to offer. But then, of course, you can get the supplementation so that you can get concentrated amounts of those nutrients that will help with estrogen dominance. Dr. Sharm, what were you about to say?
No, mine is not on pooping. I have, other.
We're done with that.
Okay, so I know that we're all naturopathic and so forth and so on, but as practitioners who are trained in all forms of medicine and in integrative medicine, we need to talk about surgical intervention, because a lot of times patients are going to come to us and they're trying to avoid surgery, and there are many cases where surgery is going to be the recommended thing. Hysterectomies is the most overperformed surgery that exists. There are many unnecessary hysterectomies. So I have to say that. However, when you have people who have very, very large fibroids, or really taking up a lot of blood supply, and they have really severe symptoms, and as a doctor, some of us may want to do some of these other interventions and might not see success, or sometimes the case may be so far gone that surgery really is going to be the best option. And so I'll give myself as an example. I had a small fibroid, and I was managing it quite well, but then I grew another fibroid, and so by the time I got to the gynecologist, this thing was 4 centimeters, and so 3-4 centimeters. So when you get into that situation and you've tried other things, sometimes surgery is the best. And I would like to talk about one of the procedures that I really like, because you have different type of fibroid surgeries. You have the myomectomy, where you go in and you're cutting into the muscle. You have embolization, which is where they cut off the blood supply. But I really love this procedure, and I had this procedure, and it's called Excessa. And Excessa is what's called radio frequency ablation of the fibroid. So what they do is the surgery is done and they go in through your belly button, through the umbilicus, and then there's a very small, like 1 centimeter bikini cut, just barely visible. So one, you're not cutting everything wide open, and they're going in, and they don't even cut the uterus. They put this radio head against it. They use ultrasound. The doctor's going to use ultrasound to locate the fibroid, and then this ultrasound, this radio head will zap. It basically zaps the fibroid, and it doesn't get rid of the fibroid that day, but as it zaps it, it's going to slowly dissolve on its own later on. And so the nice thing about it, because you're not going in and really opening up the uterus, there's less risk of bleeding. Also, the recovery is better. So for some of these other fibroid surgeries, people may be out for 6 weeks. They can't walk. They can't go upstairs. I had this surgery. I was down for 5 days. I can get up. I can walk to my kitchen. I can walk. I was told not to move too much, but I was down for about 5 days. And after that, I could go on. And within a month or month or two, the fibroids had basically shrunk, and the size of my uterus had shrunk. So I really love Accessa. It's a relatively newer procedure. So it's something that, there's certain doctors who are trained on it, but it's good to, you can go to Google Accessa and see who's performing it. But we definitely need to address the fact that not all cases are naturopathic cases. And also, once the person does have surgery, if they're one that needs to have surgery, those fibroids can come back. And so this is where our medicine comes in really well, because, hey, we get rid of that fibroid, we stop this acute issue, and then let's work on fixing this dominance or the elimination or these other things so that it doesn't come back and we don't grow anymore.
Thank you. That actually led into the conversation about the different types of surgery, because I knew of 2 of the panelists who actually had procedures, and we were going to talk about it. So thank you. I didn't know about this procedure itself. So who wants to start first? Go ahead, Dr. Imani.
So I want to chime in because I also ended up having a surgical procedure. And so I'll share a little bit about my experience. I too was very interested in the Accessa procedure and looked into it and wanted it to be an option. Unfortunately, the timing wasn't right when I looked at Accessa, and time went on, and the rate of growth for the fibroids that I had ended up being very fast. There was a concern there. They didn't know if they were possibly going to be cancerous. They needed to end up doing a procedure, a myomectomy. So myomectomy is removal of the fibroids themselves. Unfortunately, because of the size of my fibroids, I was not able to have the laparoscopic procedure where you can just do 2 small cuts underneath the umbilicus and kind of go in that way. I ended up having to have a full midline incision and then removal of the fibroids. The fibroids that I had were of such size that they had grown up past my navel, were putting pressure on liver, gallbladder, and they were constricting the movement of my diaphragm, so they were causing some breathing issues. So they really needed to come out. And so it was a necessity to have that procedure. That being said, I did use both naturopathic and acupuncture as support for prior to the procedure, for dealing with pain as I was in the hospital, because I told them I did not want opioids. I did not want to rely on opioids, and I wanted to look at some other things. So I had some other things, including some acupuncture prior to, some arnica homeopathy prior to and during, and then afterwards. And as Dr. Charm mentioned about not wanting the long recovery time, I did have the long recovery time. I was in the hospital for a total of 5 to 6 days. And then afterwards, I had a recovery time of about 8 weeks because of the extent of the surgery that I had to deal with. And so being able to have the support from my naturopathic knowledge and support from getting acupuncture really helped me to get through that period of time. But because of the size of my fibroids, they weren't something that was going to lend themselves to being able to shrink fast and just do some tea or one thing that everybody always asks about, what's the one herb that I can take. And so it was necessary to have the surgery. There were concerns, though. There were concerns with, is this going to be able to preserve my fertility? Are there going to be risks for this surgery? And of course, yes, anytime when you're cutting into the human body, there are risks. And I had to kind of discuss with my doctor. And so it's really important to make sure you have a team that is listening to you, that is responsive to the things that you are interested in, not someone who's going to do something to your body and they have their own agenda, but someone who believes in a team approach and that they are a part of your healthcare team and that you can have discussions with about what you want. I did not want a hysterectomy. And if that were to happen, it would be a last resort because they would not be able to get bleeding under control. Thankfully, my surgeon was able to navigate the surgery successfully and did not have to resort to hysterectomy. And I was able to keep my uterus. I was able to keep both ovaries and at least one of my fallopian tubes. So still being able to have some fertility. And I share this, this is a lot of information, but I share it because I feel like a lot of times there are not a lot of candid discussions where we as women can go and get the information from someone who's been through it firsthand, but also then has the medical knowledge and say, okay, so what's kind of going on with this procedure? What are the risks? What kinds of things that you do? And so I like being able to meet my patients there from a perspective of having gone through it. Not that that's necessary, but I can add to the kind of discussion and the knowledge coming from a framework of having gone through it. I kind of feel like I was all over the place there, but
No, you did fine. Now, before we move on, I do want you to mention, like, it took you a while to find a doctor who would do a procedure and not take your uterus, right?
It did. The first gynecologist I was referred to, who was supposed to be the specialist in the area where I live, and I will not name names, it doesn't matter because none of y'all are in my area anyway, was a man and did some exams and then referred me to a specialist who was a surgeon, who was also a man, and they were both very much on the agenda, have a hysterectomy. Even though I mentioned that I don't have children, and so I wanted that possibility of being able to have children, and I wanted to keep my uterus, they were very much adamant about convincing me, why do you even want that? Why do you want to keep it? And I was made to feel as if that was something that was a burden and a nuisance and that I should be ready to get rid of. And it wasn't until I changed the whole team of people that I was working with and dealing with that I found a group of healthcare practitioners. The gynecologist that I worked with also ended up being my surgeon, and she had a lot of experience with women who had both multiple fibroids and fibroids that were of a larger size, and being able to help conserve the uterus, conserve the ovaries, conserve fertility, and being someone who would listen. I felt like I wasn't listened to with the first team. And you never want to feel like that. It's your body. You want to be able to feel like the people that are a part of your team are listening to your concerns. Yes. You are not just, gone are the days where our bodies were experimented upon and we were just these lumps of flesh that were perceived not to have any feelings, and that our concerns shouldn't be taken into account and we could be experimented on. Those days are over. These are our bodies. We have the right right? The privilege, the very blessing and the gift to be able to determine what happens with our body. Find yourself doctors that are in your corner, that are on your team, because it's your body.
Thank you. And I wanted to make sure that I highlighted that because it is such a prevalent problem. Like, we already know that doctors don't listen to Black people. Doctors don't listen to Black women. I mean, anytime Serena Williams almost died in childbirth, so it's not a money thing, it's not a status thing. Why is it? Medicine is still a consumer business. You are paying for a service, and you should have people who listen to you. Even some of the comments. One comment, Amber says, in my past experiences, a lot of MDs only tell you what's wrong. You're obese, you have fibroids. They never talk about the genetic, mental health, or lifestyle piece. Part of that is because they don't know. Whether they want to know or not, that's a part of it. Someone also mentioned, and I can't remember where it was, but someone said earlier that they had symptoms and they were talking to their doctor, and the doctor never paid attention to them until she said, I can feel this thing. And that's when the doctor listened. So, I'm not saying, or we're not saying to doctor shop, but absolutely make sure that you're choosing people who are actually going to pay attention to you and who are going to be a part of your team, because that's necessary. You don't want to be with someone who's just trying to take away, your organs just because they feel like that's the easiest thing to do. It might be the easiest, but that might not be the best thing for you. All right. So there's that. Dr. Dezi, you want to share about your experience?
Yes, thank you. I just had the fibroid artery embolization procedure done about 4 weeks ago. And just again, to piggyback on what you guys said, it was like I've been dealing with this for a long time, a long time. And so during recovery, one thing I was saying to my friends is like, this is great. I feel wonderful, or I'm feeling better, but I was also getting a little bit angry because I am not a shy person. And so I've been talking to doctors about this for a long time and being ignored, just brushed off, ignored, or like you said, told like, lose some weight, it'll be all, better. No, that's not how fibroids work. And so, and I also noticed that there was like a tendency for doctors to want to give me medicines, pharmaceutical medicines, to deal with this instead of just treating the actual issue, which was the fibroid. I came from California originally, and that's where they put me on the muscle relaxant because the fibroid was pushing down on my bladder. We went in, we could see it. It was huge. It was pushing down on my bladder. Instead of saying, hey, let's get this removed, their first response is like, let's put you on expensive pharmaceutical medicines that, add toxins to your body and cause all sorts of side effects. Let's do that instead. And so finally, I found, I have both my naturopathic team, and then I have my allopathic /DOs for, surgical stuff. So I had an MD OBGYN here in Phoenix area, and he listened to me. And he's like, we're sending you right now, this week, to go and see the fibroid specialist. And the first one was horrible. He totally blew me off. He didn't really examine me. He was like, oh, you're Black, you have a lot of fibroids. And he tried to push on another procedure because he was more of a urologist. And instead of focusing on my needs, he ignored me. And so I fired his behind. I know you said not to do that and not to shop, but I fired him, and I found
No. I say don't shop. I mean, around for Dr. Lee, one that works, or if he never know, he needs to be fired. You did right. Thank you.
I fired him. And so we went to a doctor in Banner Hospital who said it would be a 2-week procedure. So I was like, well, I need to find a nice gap of time for that. But in the meantime, the pandemic broke out. And so I went to a third doctor, and he was very laissez-faire. So he did some things I didn't like, which was he didn't really prep me, or I made him have a conversation with me about the issues related to the procedure beforehand, because they were just like, come on in and we're going to do a procedure on you. And I was like, no, that's not how it happens. Sorry. Sorry. So I made him have a conversation with me, and he was like, "Oh, it'll just take 2 days to recover." And I didn't think that, 2 days versus 2 weeks. I wasn't sure about that, but I came in. I'm prepared. I'm learning what needs to be handled. And I came in. We had another conversation. We did the procedure. Literally, they pumped me full of whatever drugs they were using, and I can vaguely see them in the background. They went through my femoral artery on the right side, up through my abdominal artery, and they basically release little micro beads down the arteries that feed those fibroids. And what happens is that the fibroids slowly die over time. So I came out of surgery. I had to lay still in a recovery room for about 2 hours, and then they sent me home. And over the next 8 days, I'm like very soft. They said I can get up after 2 days. I was like, nah, I'm not getting up until it doesn't hurt anymore. But so it took me about 8 days before I was able to like go hang out on the couch. But it was actually a very easy procedure for me. My thing is that I could actually almost right away feel the fibroids. There was like big, sort of more space in my abdomen. It felt like, and I noticed like things were improving right away. I got my libido started like popping back up a little bit more, and those are good things, right? Yes. And like I said, I was noticing that more circulation going into my leg. And in fact, the doctor who performed this procedure on me said that he thought I had pelvic congestion, which for everyone listening is like varicose veins of the pelvis. The blood is not coming back up. It goes down and the arteries is not coming back up. And so I think with some of those smaller fibroids dying, it's allowing better circulation, better walking. And like Dr. Imani mentioned, I didn't even notice this, but I am breathing much better. I used to sometimes kind of wheeze and I'm not doing that anymore. So it was really simple. My only concern was that be careful, because the doctor was very, they're DO, but they were very pro pharmaceutical medicines. So they gave me both Percocet, which is Oxycontin, and morphine. And they were like, take these at the same time. And I was like, no. And so I'd rather spend more time in a little bit of pain, and then maybe take, string out occasionally a Percocet and just find some other, I was calling the pharmacy constantly, like, give me something else, call the doctor, find out, give me something else that does not come in a pill bottle with a red cap on it. Because that's how Percocet and morphine come to you, with a red cap on it. And I didn't want that. And I was very concerned about, like, first I was ignored all those years, and now I'm being over medicated. It just seems to be that there could have been a better job done with this whole process, listening to women, listening to Black women about our needs and hearing our voices. But at the same time, I am relieved that it's happened. One thing, you'll actually feel like you'll go through a period of time where the smaller fibroids are dying off and they're coming out, basically. And then the larger ones will shrink over time. And so questions to ask are they going to do the embolization process on all of the arteries or just some of them? Also questions is how long is the recovery process for reals, not just what you tell people, so they can be happy. And also, what medications do you want to give me for the recovery? And can I get something that's like not so outrageously addictive? Okay. But I'm very happy. I'm so happy. I'm happy.
Thank you. And one of the reasons why I wanted to make sure that I highlighted, especially their experiences, is because, holistic therapies are awesome. And they do help in a lot of situations, but there are times that holistic therapies are beyond, or your condition is beyond the scope of a holistic therapy. All of us have had prescription rights, and all of us have prescribed medications at some point. I myself have prescribed in the past. I did not necessarily use my entire prescription pad, but if a patient needed it, they got what they needed, but it wasn't the end all be all. They also got other support depending on their case, depending on their needs. So just know that when you walk up to someone, especially a naturopathic doctor, and you say, what herb can I take? What food can I eat? You probably won't get a straight answer. Or if you do, that is just like the one thing and of a laundry list of things that need to be done. So just kind of keep that in mind. Dr. Krystal or Dr. Olivia, do you guys have anything to add to that part of the conversation?
I just want to say that I'm grateful for this like real life experience being shared. I'm one of the people that, you know, I'm still going through the process. You know, every time I go to the doctor, they're just like, oh, you want to have surgery? No, okay. They don't want to talk about anything. So I'm looking at the measurements, trying to put the pieces together myself, just trying to figure it out on my own. Because, you know, we don't have a whole lot of naturopathic doctors here, but we do have some, and I'm trying to figure it out. But I'm just so grateful for them sharing their real life experience, because for me, I'm a little less scared if it comes to those options. For me, I'm like, okay, these are two people that are very educated, and, you know, I trust their experience, not like these people that have an agenda, but I trust what they say. So that'll help me make decisions, and that'll help me give more resources to my patients. So Thank y'all for sharing, and thank you for having this.
Absolutely, absolutely. Okay, so Dr. Dezi, what did you say your procedure was called again?
It's a fibroid artery embolization.
All right. Fibroid, I'm gonna type this up. Fibroid artery embolization. All right.
And it may affect fertility. It depends.
Say this again.
It may or may not affect fertility. It depends on who you ask and what they do. My doctor didn't seem to think it would, and I don't see why it would have.
Okay. Thank you. Dr. Olivia, do you have anything to add to that part of the conversation? Okay. Nope. All right. So another thing that I wanted to make sure that I mentioned is that even if you have to have a procedure, holistic therapies, naturopathic therapies can absolutely help you before, during, and after, right? The pain, the speed of recovery, the way your body recovers, naturopathic therapies, holistic therapies can help. So it's never an either or. It's never an either or. It's what is the best thing for you at this moment? And then let's move on with the next best things at any particular time, constantly reassessing. So there's that. I do want to make sure that I answer this question. Someone said, can you discuss fibroids and menopause? I hear that doctors only recommend hysterectomy if you have them during perimenopause and menopause. Have you guys heard that, or is that the case?
No, the thing about menopause is interesting because a lot of times people, as we age, women's estrogen levels will decrease, and so you have women who may have had problems with fibroids in their childbearing years, and even perimenopause. And as they age and they go into menopause, they no longer have these issues with fibroids. So sometimes it can really be the opposite. I know the doctors are probably thinking about preserving fertility and the age, as far as for those who may really be in need of a hysterectomy, which a lot of times, again, on my earlier point, that it's overprescribed, and listening to some of these ladies' experiences, it's overprescribed. But in some instances, when we're dealing with these menopausal women, we may just want to wait and maybe work with them naturopathically and just see with the hormone decline as far as estrogen, it may not be an issue anymore as they age.
Right. Thank you. Anyone else?
That's what was told to me, because I'm over the age of 35, kind of, you know. And so I was concerned that they, you know, once I found a doctor who was willing to do what I wanted done, that they were suddenly going to notice in my file, like, oh, hey, she's probably not going to have a ton of kids after this. And that they were going to decide I should just wait And I didn't want to wait. I've been putting up with this for a long time. I wanted this done. And luckily my doctors supported, and no one ever once said, I mean, they said at the beginning, like, you can wait because when you turn like 50 something, the fibroids will go down in size. But I was like, no, let's have it happen. And no one ever said not to do it. And the insurance was there for me too. And so I was able to finally get my health taken care of. So, don't let that stop you just because you're, perimenopausal or menopausal.
Absolutely. Now, any last words, anything that you definitely want people to walk away with from this conversation? I want all of you to share something that, absolutely, if you hear nothing else from you, that you want them to hear that. Dr. Imani, we'll start with you.
So I want women to walk away from this conversation knowing that there is hope, because a lot of times, especially, I can even talk about my experience and the experience of several of my patients. They got to a point where they were feeling like it was almost hopeless. They had these things and they felt like because of having fibroids, that they didn't really have control over their bodies anymore. They didn't know which way to turn. And there was a lot of confusion, frustration, fear, and hopelessness. And so there is hope. And that right here before you, you see 6 different practitioners who are knowledgeable, who are ready to be able to help you to navigate this. And if it's not us, then find practitioners in your area that can be a part of helping you to navigate, and make sure that you're looking for practitioners who not only listen to you, but are there to answer your question and are open to other things and not just pursuing their own agendas. There is hope. Thank you.
Thank you. Dr. Shelmire.
Would just like to add, as naturopathic physicians, like they say, we listen for the hoof print or we know that they're horses, but we look for the zebras. So, yes, all of these things are common, the estrogen dominance, but like I said, for me personally, it was the genetic component and really addressing the mental emotional component. So I would just say, really look to figure out what is your root cause, because if you don't figure the cause out, you're going to have the problem recurring. So really figure out what that is for you. Reach out to a naturopathic physician or whatever, can help you get to that point. But there is hope, and there are people out there that are trying their best to help you if you just reach out.
Thank you. Dr. Dezi.
I would just like to say that fibroids affect primarily often African-American women. When you think African-American women in the medical field, you think fibroids, but also Middle Eastern women and Latinx women. So don't, and these are all like communities that have historically just not been heard as much by their physicians. And so don't let that be a deterrent. When something's wrong with your body, just stay, proactive to get the services you need. And you've heard just today that there are so many different treatments, naturopathic treatments, nutrition, and different surgery options. Make sure you get one of them done. Don't wait like I did. I didn't really wait, but don't let someone else make you wait like I did. Get it done. Take care of yourself.
Thank you. Dr. Charm.
Yes, I just want to, I think I've said most of what I want to say, but be positive. I did forget to mention that iodine, look at your iodine levels, because iodine can affect fibroids. It can affect fibrocystic breast. It can affect a lot of things. And people can be deficient in this mineral, and it's found in sea kelp and seaweed and these kind of things. I think sea moss is really popular now. So I'm kind of glad that that's happening. But it's just overall for inspiration. I am a fan of doctor shopping in the sense of, I tell patients this all the time. If you go to Macy's and you had a bad customer service experience, are you gonna keep going to Macy's, or do you want to try Dillard's or try somewhere else? So the doctors can be fired. They're very fireable, and It is not a situation where anyone should put up with disrespect.
Absolutely.
And get a support system around you of people who really care about your health and your support team, whether that be medical or not. And that's really important for outcome.
Absolutely. Thank you. Dr. Olivia.
I really liked what Dr. Shelmire said about addressing the root cause. This is something that we didn't mention in our conversation, but sexual trauma is really important when we're talking about fibroids. It's not something that science can quantify, but whenever you have trauma to an area as sensitive and vulnerable as the womb, energy is stored there and memories are stored there. So I think we have to really be aware of past traumas as well. And like you said, just having a team of people talking through those traumas, reframing the way that you think about your body, the things that you say to your body, because whatever you think, the body follows. So just having that open-minded approach that it isn't just physical, it's all different sides of us that continue to feed this process.
Thank you. And I want to mention, is not the end all be all. There are other procedures, there are other natural things. None of it will happen tonight. Even if you surgery, you still have to deal with the healing process, and you have to figure out what needs to be done afterwards so that they don't return. And that goes back to root cause. So just know that you didn't get these overnight, that it's not going to go away overnight, but it is possible to deal with it from a natural, holistic point of view and from a surgical point of view if you have to. Find a team of doctors who are on your side, who listen to you, and who give you real information. When I said don't doctor shop, I meant just jumping from doctor to doctor just because you felt like it. But absolutely find a doctor or a team of doctors who are on your side, who listen, and who will do as much as they can for you, the patient, the customer. You are a consumer. So shop with your dollars, like you do, as she mentioned, for everything else. Shop with your dollars. Make sure you're being heard. That's it. We've been on for a while, and so we're going to wrap up the conversation. So now I actually want these doctors to tell us how they can be contacted. Let's start again with Dr. Imani.
All right. So you can reach me at Dr. Imani ND at gmail.com, and I'll spell that out for everybody. That is DRIM as in Mary, AN as in Nancy, IN as in naturopathic, D as in doctor at gmail.com. You can find my website at DrImaniND.com. You can also find me on Facebook at Imani Owens-Bailey. And if you are in the Pacific Northwest, in the Tacoma area, the Lacey area, or the Olympia area, that's where I practice. And so reach out to me. And I also do telemedicine. So I look forward to hearing from you all.
Thank you so much. Dr. Shelmire.
I can be found, my business is Alternative Natural Health Solutions on Facebook. You can find my business page there. Also, I can be reached at 337-541-8125 because my office is physically located in Lafayette, Louisiana. Or I can also be reached by email at kshelmirend@gmail.com. Or you can Google me.
Thank you so much. And I am typing your information as we speak. All right. And who's next? Dr. Dezi, how can they contact you?
I'm on Facebook at Dezi Nebed, DeziNebed. And you can find me there. I'm in Tempe, Arizona, outside of Phoenix. I have a new website that's going up, but it's not quite ready. So I will refrain from sharing that one right now, but I'll post it later.
Thank you so much. And Dr. Charm.
Yes, you can find me on Facebook at Dr. Charm Tims. That's DrCharm, T like Tom, IMS.
Thank you so much. And Dr. Olivia.
You can find me at livingwellnessmedicalcenter.com. That's the practice that I'm currently at. We are in Phoenix. You can also email me at Dr. Watkins at livingwellnessmedicalcenter.com.
All right. And I am Dr. Turshá Hamilton. You can find my website at Dr. Turshá, www.drtursha.com. That's DRTURSHA.com. And on all the social medias, Facebook, Instagram, Twitter, you can find me at Dr. Turshá. Again, DRTURSHA. Again, make sure that you are following the Indies of Color on Facebook and Instagram so that you can get information about different naturopathic doctors of color who focus on different areas of health, all with fantastic information, very enlightening information that you can use, that you can pass on. And if you have a question, if you have a topic that you'd love to have us discuss, please make sure that you send that information to the Indies of Color, either on Facebook or Instagram, or even email indiesofcolor@gmail.com. Thank you for your time. Thank you for joining us. Thank you for your comments. And we look forward to speaking to you in the very near future about another topic. Thank you so much, and we'll see you next week.
Thank you for having us.
Thank you.